Airport. However, Mr. Speaker, I have noted that the very critical areas in Hellas, especially in Sabay, have been left out. I don't see anything supporting us. For example, when we came up with the policy to hold the creation of district hospitals, we accepted because we knew this would be a chance for us to have health centers in all the sub-counties, which is not happening. And even, for example, in Bukwa district, we already had a district hospital. But sometime, we said around 2023, it was downgraded back to Health Center 4, Mr. Speaker. Yes, and now Bukwa, which is a district bordering Kenya, does not have the district hospital. And is a very highly populated area, Mr. Speaker. Mr. Speaker, I have also noted that the statement does not include the creation of a regional hospital in Sabay, which has been, we were promised when we started this parliament. We were told that the referral hospital for Sabay will be in the budget. And now it is not there, Mr. Speaker. Finally, Mr. Speaker, even the health center force that we were promised does not appear anywhere, and this would help us areas without the district hospitals. For example, me from Queen, we are really waiting, and we are still patient, waiting for the district hospital, which we saw with our hearts would be covered by having the more health center force and the health center 3s. And I want to end by also adding on to what the Honorable Mudimu said about the Mbala Hospital. The situation in Mbala Hospital is really bad. And now this is the referral hospital supporting all of us, the entire Sabay districts, all of us, we come to Mbala Hospital. I really want to support and request that even as we wait for others, really help us allocate this 5 billion to complete this structure in Mbale, because it is highly.
Honorable Masokot, Bunyoro, I had forgotten Bunyoro, Honorable Kiki, and then Rob.
Thank you, Mr. Speaker.
Just let me first make it clear. Colleagues, I did the round, and then I looked at regions which had not been captured, sub-regions. So I went, that's why I picked Sebei, I picked Karamoja, to ensure all of them, at least every region on health, are captured. Thank you.
Thank you, Mr. Speaker. I join the colleagues to thank the chairperson for the committee. Mr. Speaker, to start with, you have been emphasizing about the PET machine for the testing the cancer. But there's this one also about the dialysis machine for those who are, all of us are victims of kidneys and kidneys failures and a problem into it. I also recommend we put some fund so that most of our regional referral hospital, we put this machine, because like in Kitgum, Agago, everybody has to run and goes towards Oyam. Number two, Mr. Speaker, there was a project which the minister have to fast track it about the teaching hospital in Gulu University, to have that wing. We held several meetings about it, and even the sub-region acquired a land waiting for that project to be launched. Maybe you get some time and fast track it. Number three, Mr. Speaker, I support the idea of creating Kitgum Medical Hospital into regional referral hospital. Many people who are coming from Eastern, actually, they have to go not even to Gulu Regional Referral Hospital, but they go to Lacho instead. That tells us even the services are regional referral hospital. Much as we are emphasizing the private wings of hospital to be developed into proper services, those services are regional referral hospital. We have to check and improve into it. Mr. Speaker, there is a change. The government has changed the policy of health center 2 into 3. I think they have to revisit this policy. We have policies, they don't even have health center 2. Even those with health center 2 have not been changed into health center 3, and the policies are also as big as sub-counties. A point in case in my county. Finally, as I conclude, Mr. Speaker, I have written to the Minister of Health. They have talked about it. Kalon Town Councils, since all this period, they don't have government facilities like health center, 3 or wherever kind of health center unit you want to place. Why don't you put some small money? This is the center, it is the center of Agago North County. Beside the ambulances which you have not given unto us, let us roll it out. Many of us are now talking about those.
Thank you, Neighbor Kiki.
Thank you, Mr. Speaker, for the opportunity. I wish to thank the chair and the committee members for the good report. For starters, wealth is health, or health is wealth. I'm talking to, I address myself to Masinde Hospital, which was built 1922. Actually, it has outlived its existence. I'm happy that it has been highlighted as one of the beneficiaries. We just hope that our dream will come to pass this time around, because it has been appearing in all these financial years, but nothing has come to pass. Number 2 is on the national insurance. The Committee on Gender, Labor and Social Development visited Zambia, and actually we found out that Zambia, the national insurance is working. Zambia is one of the poorest countries. And we have a good report. I don't know if it has ever been represented here, but Zambia is doing very well on the national insurance. So let us maybe have another debate on this insurance. It is workable, it is practical, and it will solve a number of problems. Number 3, in the report, I don't know how we can budget for prevention is better than cure. Mr. Chair and the Minister, do we have a budget for prevention? Because some of these diseases can be prevented so that we don't go to hospitals. Is there a budget for prevention? What have you put under that item so that we have very few people going to hospital and we can prevent the disease? Now, and lastly, VHTs. Have you put anything for VHTs? They do a lot of work in our communities. Thanks so much, Mr. Speaker, for the opportunity.
Thank you. Thank you. Now, honorable colleagues, I just wanted Honorable Amos who raised the issue of dialysis and what. Now, Minister for Finance, what is so special about the PET machine? And last time we were here with you, and you remember how emotional Honorable Kawoya became here on the floor and said anyone who has not yet gotten cancer is the one who doesn't know what a PET machine means. Because a PET machine is basically for early diagnosis. If you get cancer early, then you're able sometimes to treat it successfully. Most of the times we get it when it's late. Because you want a PET machine, you go to Nairobi. The cost of Nairobi, how many people will afford? What I checked, Minister of Finance had put around 37.5 billion, I think, in the budget, whereby 4 billion was for reagents, and then 33.5 was for construction of the center. But the question is, how do you buy reagents before buying a machine? I don't want us to go to a situation which we had here when we were handling the policy statement for agriculture, where they brought castrated bulls for the breeding program. that would be really a bit close. So, Honourable Minister, I request you cross-check with your team on the issue of the PET machine. Good, yes.
Mr. Speaker, yes, I remember you raised